Hello, my name is Dr. Jessica Leatherwood, and I'm an associate professor in the Department of Animal Science at Tarleton State University and a proud lifetime member of the American Quarter Horse Association. In this video, I would like to highlight a recent study supported by the American Quarter Horse Foundation involving the response of healthy joints to intra-articular corticosteroid administration in young exercising horses. This study centered on the use of triamcinolone acetylene, which has been reported in the literature to be most frequently used by veterinarians for horses in their high motion joints. This study had 3 treatment groups, a 6 mg and 12 mg dose of triamcinolone into the intra-articular space, along with a control or sham injected joint in which the carrier was only utilized, so that we can discern the effects between the injection alone in our control group compared to our treatment groups of both 6 mg and 12 mg. In this study, horses continued on that advanced or progressive workload over a 56-day period. Synovial fluid samples were collected following aseptic prep, and arthrocentesis was performed by a veterinarian associated with the project. Synovial fluid samples were collected on day 0, immediately prior to the administration of the various treatments, and again on day 7, 14, 28, and day 56. Remember, all horses remained on a progressive workload, and horses were housed in individual stalls with attached runs and fed their dietary concentrate at 12-hour intervals, along with ad libitum access to coastal Bermuda grass hay and water. Moving into the laboratory and evaluating the synovial fluid, my lab in particular is interested not only in inflammation, but cartilage as well, and how the triamcinolone may impact overall cartilage metabolism, because we know that cartilage is avascular and aneural, and time in which that horse is able to completely turn over hyaline cartilage within that articulating space is relatively long and likely won't even happen during their lifetime. We found that the use of intra-articular corticosteroid reduced synovial inflammation in both the 6 and 12 mg dose with no effect on the control injection. As anticipated, the use of this corticosteroid was successful in mitigating against this inflammation. However, it was important to note that the increasing dose of triamcinolone did not differ on mitigating the inflammatory response. So perhaps simply increasing the dosage of the triamcinolone administered to your American Quarter Horse may not be beneficial as anticipated. Realizing this is a young horse model and horses were considered to be healthy within that joint space following radiographic evaluation. Therefore, we saw that triamcinolone in this study was effective at mitigating intra-articular inflammation. In addition to inflammation, we also evaluated markers of cartilage metabolism described as both synthesis and degradation. What was interesting in this study is that we found that young horses, in our case 2-year-olds, had an increase in both synthesis as well as degradation in the short term from day 0 to day 7, in which we saw peak levels of these biomarkers in response to the triamcinolone injection of both 6 and 12 mg when compared to the control group. Overall, what this means is that there was an immediate shift in cartilage metabolism, both synthesis as well as degradation, in this young exercising model. So again, when we think about how these corticosteroids may impact cartilage metabolism, we've simply looked at one biomarker, both related to synthesis as well as degradation within the synovial fluid space. But it's also important to note that we did not look at the actual cartilage itself in this study, but those biomarkers can give us an idea or provide some guidance as to what's happening within that intra-articular space. So in addition to inflammation and cartilage metabolism, we were also interested to see if the triamcinolone impacted pain perception. And we utilized a marker known as substance P, which is a neuropeptide and an indicator of pain. And we found that the triamcinolone injection had no impact on substance P concentrations. However, they were influenced over time and increased to correspond with the progressive workload to which the horses underwent. So in combination, when we look at all of these different factors and we're evaluating our futurity age horses, I think that there are a few points to definitely highlight as a result of this study. That being that the use of the triamcinolone acetonide in 2-year-old exercising horses reduced overall synovial inflammation as expected. However, interestingly enough, we did see a change in cartilage metabolism, at least in the short term, out to day 7 and even to day 14 in some cases, when we look at these individual biomarkers related to synthesis and degradation. Therefore, not only did the use of the triamcinolone increase synthesis, but also increase degradation, which is a point to be considered. Lastly, there was no impact on pain perception as measured through this single biomarker. And one should consider this as part of their use and implementation of corticosteroids such as triamcinolone if they are preparing for a competition that is coming up, to allow those horses to rest for an adequate amount of time. So when we typically think of horses returning to work following the corticosteroid administration, perhaps we consider a longer time of rest if that is possible. It is thanks to members like you and donors to the American Quarter Horse Foundation that make this possible, not only to improve the health and the welfare of the American quarter horse, but to also provide a training ground that is invaluable to both graduate and undergraduate students that are interested in equine science and will one day represent the future of our industry. This impact is not only here at Tarleton State University, but across multiple institutions, including Montana State University, Texas A&M University, and Texas Tech University. Thank you for your continued support, and always enjoy riding your American quarter horse.